Hi, this is Jackie Simmons, and this is my final head-to-toe video assessment, and this is my surrounding right here. Okay, there's the patient. Alright, so before I begin the assessment and before I enter the patient's room, I'm going to check her chart. I'm going to come in, provide privacy. I'm going to perform hand hygiene. While I'm performing hand hygiene, I'll be introducing myself, and I'm also going to check the patient by two identifiers. Okay, hi, I'm Jackie. I'll be your nurse today. And can you tell me your name and date of birth?
Rayvon Johnson, 12095.
Okay, and Rayvon, what brings you in today?
Just a checkup.
Okay, and currently, do you have any pain or discomfort?
No.
Okay, and do you know where you are?
Hospital.
And what year is it?
2020.
And who's the president?
Donald Trump.
Okay, so by that, the patient is alert and oriented by person, place, and time, times 3. And can you wiggle your fingers for me? And can you turn your head? Okay, so by that, with the Glasgow Coma Scale, I'm going to rate the patient at a 15. She's fully alert. She was also able to understand what I was saying. Okay, now just with a few neuro, I could do like a little neuro assessment on you. Let's see, so the patient's posture, she's erect. She's very well groomed. Her attire is appropriate for the assessment and for the weather. Her hygiene is appropriate as well, no foul odors. Her posture was erect. Her mood and affect is appropriate as well. Her facial expression is appropriate, it's relaxed. Her posture was relaxed as well. Her thought process was appropriate. She's able to understand what I'm saying, and I'm able to understand what she's saying. Her thought process is logical as well. Okay, and with the Glasgow Coma Scale. Okay, so now I'm just going to ask you just a few questions.
Okay.
Okay, do you have any allergies at all?
No.
Okay, no food or medication allergies?
Actually, I do. I'm allergic to erythromycin, codeine, and Bactrim.
Okay. Let's see. So we did some allergies. You're not in any type of pain. Okay. Now, as far as your skin, like your skin all throughout your body, do you have, are there any type of ointments or lotions that irritate your skin?
No.
Okay. Does your skin become excessively dry?
No.
Okay. Do you sweat a lot?
No.
Okay. Now, with your hair throughout your whole body, do you have problems with excessive hair growth, or does your hair not grow enough for you at all? Okay. And have you had any type of baldness at all in any of your areas of your body with hair? Okay. And do you moisturize your hair often?
Yes.
Okay. Now with, let's see, your head, have you ever had any type of trauma to your head at all?
No.
Any head surgeries?
No.
Okay. Have you felt any type of masses or deformities at all on your skull or anything?
No.
Okay. Now with your eyes, do you wear glasses or contacts?
I wear glasses at night.
Okay. And when was your last vision exam?
I'd say about 8 months ago.
8 months ago? Okay. And do you squint a lot with or without your glasses?
Probably more if I don't use my glasses at night.
Okay. Now, as far as your ears, do you have trouble hearing?
No.
Have you ever worn hearing aids?
No, I haven't.
Okay. Have you ever had swimmer's ear?
No, I haven't.
Okay. Now, with your nose, have you ever had problems smelling?
No.
Okay. Have you ever had or do you have problems with your sinuses at all?
No.
Okay. With your mouth, let's see. Have you ever had any type of drainage in your mouth at all?
No.
Okay. Any type of, have you noticed any type of, any like lesions or anything?
No.
Okay. Do you have a family history of like cancer inside the mouth at all?
No.
Okay. Now, as far as your neck, do you have a family history of thyroid cancer?
No.
Okay. Have you ever experienced swelling or felt any hardening on your neck?
No.
Okay. Now, with your chest, do you have a family history of lung or heart diseases?
No.
Okay. Is it hard for you to breathe when you're sleeping or walking?
No.
Okay. Have you ever experienced a stroke or, let's see, a heart attack at all?
No.
Okay. And back to your a neurological question, do you experience frequent headaches or anything?
No.
Or dizziness?
No.
Okay. Now, as far as your abdomen, when was your last bowel movement?
Last night.
And was it regular?
Yes.
Okay. Have you ever had hemorrhoids?
No, I haven't.
Okay. Any blood or mucus in your stool?
No.
Any blood or mucus in your urine?
No.
Okay. Any abdominal surgeries at all?
Not at all.
Any frequent urges to urinate or burning when you urinate?
No.
Any clouding or UTI? Have you ever experienced that?
No.
Okay. Reproductive questions. Are you on birth control?
Yes, I am.
And do you practice safe sex?
Yes.
Okay. Have you had any type of reproductive surgeries?
No, I haven't.
History of any type of diseases, reproductive diseases
No.
at all? Okay. Now, as far as your extremities, have you had any problems with ranges of motion, bending, picking up, or pushing or pulling against anything?
No.
Okay. Any back problems?
No.
Okay. Any pain when you sit down or stand up?
No.
Okay. Now, musculoskeletal questions. Have you ever had any bone or joint pain?
No.
Any swelling at all?
No.
Okay. Let's see. Any problems with grabbing anything or anything of that nature with your
No.
bones or joints? No tenderness at
No.
all? Okay, good. All right, so now what I'm going to do is, after I ask all of those subjective questions, I'm going to go on and perform an assessment on you.
Okay.
Okay? So now what I'm going to do is I'm going to assess all of your skin and I'm going to assess all the hair on your body, okay?
Okay.
So just by assessing the patient's skin, her skin is warm to touch and dry. Okay, I'm not seeing, I'm just going to have you lift your shirt up a little. Okay, the skin temperature is appropriate as well. It's not excessively warm or excessively cold. I'm just going to look at the skin on your back as well. Okay, so while observing all of the patient's skin, I didn't notice any signs of pallor, jaundice, no nodules, papules, vesicles at all, no scarring at all on the patient's skin. I'm not seeing any discoloration at all. The patient's skin tone is appropriate for her ethnicity. She also has pink undertones throughout. Also not seeing any signs of bruises, which is a good finding as well. Now with your hair, the patient does have a little bit of hair distributed evenly on her legs and her arms as well. Okay. And as far as the hair on her head, the patient doesn't have any, I'm not seeing any lesions at all, any signs of bald spots at all. The hair is evenly distributed, well groomed, and it's not excessively dry either. And it's also appropriate for her ethnicity as well. Now, after doing hair and your skin, now what I'm going to do is I'm going to assess your arteries before I forget.
Okay.
Okay, so right here, I'm just going to have you scoot up a little.
Okay.
Okay, so we're just going to palpate the temporal artery right in here. And that'll be +2 equal bilaterally. And now what I'm going to do is check her carotid artery just one at a time. I don't want her to pass out. And that's a +2 equal bilaterally. Now what I'm going to do is check your brachial and then your radial pulses. Okay. So I'm going to go right in here. Okay, that's a +2 equal bilaterally and your radial pulse. +2 equal bilaterally. Now I'm going to have you, I would check the patient's femoral pulse, but we're not going to do that in this assessment. Okay, but what I am going to do is have you raise your legs. Okay, I'm just going to check your popliteal right behind the kneecap. And that's a +2 equal bilaterally. I'm going to check the, posterior tibial. That's a +2 equal bilaterally. And the dorsalis pedis, +2 equal bilaterally. Okay, now what I want to do is check all your cranial nerves. I'm just going to have you sit up for me.
Okay.
So as far as cranial nerve 1, which is the olfactory nerve, have you had any type of problems with your smelling?
No.
Okay. Now if the patient did experience problems with her smell, I would put some type of aroma underneath her nose and have her identify that. But since she doesn't have problems with that, cranial nerve 1 is intact. Now as far as cranial nerve 2, have you had any problems with your vision at all?
No.
Okay. If the patient had problems with her vision at all, we would perform a Snellen exam. We would have a chart and have her identify it and see if she passes. So for that, cranial nerve 2 is intact. Okay. Now with cranial nerves 3, 4, and 6, I'm just going to look at your eyes.
Okay.
I'm sorry. Let's go back to cranial nerve 1 with your smell, and we're just going to look at your nose. Okay, so I'm going to have you hold one nostril, breathe in and out on both sides. Okay, any problems with that?
No.
Okay, now what I want to do is look inside your nose. Alright, I'm not seeing any type of discoloration, a little bit of hair, but it's evenly distributed. I'm not seeing any perforations at all going into the other nostril. I'm not noticing any type of drainage at all, no bleeding, which is good after that sneeze. Okay. I'm also not seeing any type of deviation of the nose either. It's also midline to the rest of the patient's head. Her skull is symmetrical and cephalic. It's midline. I'm not noticing, or I didn't feel for any masses or bulging at all on the patient's skull or her face. Her hair on her eyebrows and eyelashes are evenly distributed. Okay, so doing cranial nerves 3, 4, and 6, we're going to go on and do that. Before I begin that, I'm just going to check the size of your pupil here. And I'm going to say that's about a 4. Okay, and a 4 over there as well. Now what I'm going to do is measure the outer canthus with the top of the patient's ear, also known as the pinna, and see if it is equal and symmetrical. Okay. Okay, and that is equal and symmetrical with the outer canthus and the pinna as well. Okay, and I'm just going to flick a light in your eye. Okay. Okay, and the patient's eyes did accommodate to the light. I did notice any abnormalities with that. Okay, now I'm just going to check for any opacities at all, or any type of foreign objects. Okay, so it looks like the sclera is white and the conjunctiva is pink and moist, which is a normal finding. Okay, now I'm just going to have you focus on that wall over there. And then I'm going to bring my pen light into you, okay?
Okay.
Okay, so the patient's eyes did respond and react to that appropriately. Okay, now we're going to do 6 cardinal gauges, okay? So just follow the pen light and don't turn your head. Okay, so the patient was able to perform that as well. So cranial nerves 3, 4, and 6 are intact. There were no abnormalities noted there. Okay. Also with the patient's eyes, I'm not seeing any type of drainage, no discoloration. They're not excessively red at all. I don't see any type of puffiness or inflammation underneath her eyes either. Okay. Also again with the nose, it's symmetrical. As far as, let's see, so we did 3, 4, and 6. Okay, again with the cranial nerves, as far as cranial nerve 5, I'm going to have you open and close your jaw. And again. Okay, and I'm going to just let me know if you feel a sharp or dull sensation and close your eyes for me.
Dull. Dull. Sharp. 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 Dull.
Okay, so by that, the patient responded appropriately. Cranial nerve 5 is intact. Now, as far as cranial nerve 7, can you raise your eyebrows and puff your cheeks? Okay, and can you smile and frown? Okay, so that by that, cranial nerve 7 is intact. Now with cranial nerve 8, okay, I'm just going to whisper in your ear and you let me know where you hear it and what you hear.
Okay.
Okay.
Right ear cat. Left ear dog.
Okay, now I'm just going to have you stand up and check for Romberg.
Okay.
This again includes cranial nerve 8. And by this, I'm just checking to see, again, supporting my patient, but I'm checking to see if the patient is swaying excessively, and she's not at all. She doesn't appear to be doing this in an abnormal way at all. So cranial nerve 8 is intact. Okay, I'm just going to have you sit down again.
Okay.
All right. Now, as far as cranial nerve 9, can you swallow for me? Okay, and can you stick your tongue out and say ah? Okay, so with that, the gag reflex, cranial nerve 9 is intact. Okay, now I'm just going to look inside your mouth and I'm going to check for cranial nerve 10. So with cranial nerve 10, it appears that the soft palate and uvula were raised to midline. The patient's tongue is at midline as well. I'm not seeing any type of deformities or abnormalities with her tongue. No discoloration. No like burn marks on her tongue either. Okay, and just you can close your mouth now. Just looking at the patient's lips, they are symmetrical to the face. They are pink and moist. They're not. They don't appear to be dry, cracked, or bleeding as well. Let's see, and go on and open and pull your bottom lip down for me. Okay, so just looking at the person's let's see, bottom lip and her gums, and lift your top lip up for me. I'm not seeing any discoloration or signs of infection, no inflammation at all. Her gums are pink and moist, and they're not bleeding either. And I'm just going to look at your teeth. Okay, all the patient's teeth are intact. She doesn't have any dentures. There's no discoloration on her teeth. I didn't notice any signs of cavities either. Okay, and just want to look at your hard palate and soft palate. They're both pink and moist, which is good. Your pharyngeal wall and buccal mucosa are also pink and moist. Okay, and your tonsils, I can see those. I'm going to grade that at about a 2 for your tonsils. Okay, so let's see. So we did 3, 4, and 6. We did cranial nerve 5, we did cranial nerve 7, we did cranial nerve 8, also cranial nerve 9 and 10. Now as far as cranial nerve 11, what I want you to do is push up against my hands, okay, and turn against me. Okay, any difficulties with that?
No.
Okay, so patient's cranial nerve 11 is intact. Now as far as cranial nerve 12, are you able to say light, tight, dynamite?
Light, tight, dynamite.
Okay, so the patient's cranial nerve 12 is intact. So again, with performing that assessment, I didn't notice any abnormalities within those cranial nerves that were performed. Okay, now what I'm going to do is just look inside. I'm just going to palpate your tragus here on both sides. Okay, let me know if you feel any pain or tenderness there.
Okay. Nope.
Okay, and the mastoid just behind the ear.
Nope.
Okay, I'm just going to pull on the pinna on both sides is what I'm doing.
Nope.
Okay, No pancreas there, right?
Nope.
Okay, now just looking on the outside of my patient's ear, she does have her ears pierced. The skin color is appropriate as well, again, throughout the body. Let's see, I'm not seeing any type of scabs, scars, or lesions at all. Looking inside the ear with my pen light, I am able to see a little bit of hair. It is evenly distributed. I'm also able to see a little bit of cerumen. It's not excessive at all. Okay. I'm just going to look at the other side. Okay. And not seeing any foreign bodies on either side of the patient's ears. A little bit of cerumen and hair is evenly distributed. Okay, now if I had an otoscope, I would be able to look at the patient's tympanic membrane, and I would pull the pinna, turn your head a little bit, pull the pinna up and back and look with my otoscope in there, and then I would be able to note if there were any abnormalities with the tympanic membrane. It shouldn't be any obstructions at all. The tympanic membrane should be a pearly grayish color, okay? On both sides, equal and bilateral. Okay, so we did your hair, the head. I didn't feel any masses at all, no bulging, no signs of, what is it? No deformities at all with her head. Everything is normal and perfectly round and shaped. Okay, we did your ears, your eyes, your nose, and your mouth. And I had you breathe in and out with your checking for patency. Okay, now what I'm going to do is your neck. So what I'm going to do is check your thyroid. And this might be a little uncomfortable for you, but what I would do is pull right behind the muscle here and palpate in this area. And I'm just feeling for any type of masses or bulging or excessive hardening at all. I'm going to do the same on the other side. Just pulling it back. Okay. And it feels as though there's no abnormalities with the thyroid. I didn't feel for any masses, bulging, or any type of hardening or stiffness at all with the thyroid. Okay, now what I want to do is I'm going to palpate your lymph nodes. Okay. So I'm just going to have you turn to the side.
Okay.
Okay, now what we're going to do is palpate preauricular, right in here, postauricular, okay, and this would be occipital in the back of the head here, okay, this would be posterior cervical, okay, and then move your shoulders in just like that. This would be supra, you can see, supraclavicular right in here. Okay, I'm going to have you bend your neck. Okay, that would be deep cervical there. Deep clavicular. Okay, deep cervical. And then this would be supraclavicular here. Okay, this would be, where is it at? Tonsillar, right in here. This would be submandibular, right in here, and this would be submental, okay. And I believe I hit all of those. Just going to go through it one more time. This will be preauricular, that's 1. Postauricular is 2. Occipital is 3. Posterior cervical is 4, and shrug your shoulders in. Supraclavicular is 5, and then bend your neck. Here's deep cervical. That's 6. Here is tonsillar. That's 7. And I believe I didn't do supraclavicular right here. That's 8. And then submandibular is 9, and submental is 10. Okay. So while palpating all the patient's lymph nodes, they weren't palpable at all, which is a good finding. I didn't feel any hardening at all or any masses while palpating for her lymph nodes, which is good. Okay, so now I'm just going to have you face forward for me. Okay, so now what I want to do is I just got done with your neck. Actually, no, I didn't. I'm going to check for bruise.
Okay.
And I believe I already checked your carotid artery, I believe. So I'm just going to check it again just to be sure. Now, for checking for bruise, I'm going to use the bell side of my stethoscope. I'm going to have you breathe in, out, and then hold for me, okay? All right. Breathe in and out. Hold. Okay. I'm going to check the other side. In, out, hold. Okay, so while checking the patient for bruise, no bruise were noted. Didn't hear any abnormalities at all while checking for that. Now, what I'm going to do is again check your carotid arteries. I don't remember if I had did that, but I believe I did. I'm just going to do it one at a time. And that's a +2 equal bilaterally, no abnormality there. And I'm also going to have you lay back and check for your JVD. And we'll be checking to see if we have findings or not. Now, if there were findings, I would have the patient raised in her bed at a 45-degree angle. Okay, and turn your neck for me. Okay, no findings there. I'm just going to check the other side. Okay, no findings there. Okay, I'm going to have you sit up. And just to be sure, I'm not sure if I checked for skin tugger, but I'm going to check that now. And it should snap back in less than 3, which it does, so that's good. I'm going to check for cap refill, and I'm going to have you, I'm just going to check for the 3 middle fingers to see if they come back in at a normal time and normal color. I'm going to check your feet also. Okay, all right. Just checking the 3 middle toes for cap refill. Okay, again, no abnormalities there. The cap refill was less than 3, which is great. Okay. Oh, shoot. All right. So now what I want to do is I assessed your ears. I assessed your eyes. Again, no opacities or abnormalities with the eyes. I didn't see any scratches or scarring within the eyes also. I assessed your nose. We checked for patency and everything. I assessed all inside of your mouth. We did lymph nodes. We did cranial nerves. I assessed your neck. Now what I would like to do is we did all the arteries. We did cap refill. Okay, now what I'm going to do is assess your lung field and your heart. Okay, so I'm going to have you sit up. All right, so what we're going to do is map out the patient's lung field. Okay, so the lung field will begin for the anterior portion. Will begin. We're going to first we're just going to palpate the patient's chest. Okay, looking for crepitus. I'm not finding anything there. I'm just going to have you turn. I'm going to check for crepitus on the patient's back. No crepitus there. I don't feel like any type of crackling, type of feeling at all. Okay. Now, what I want to do is palpate your lung field, and I'll just be like in a J formation right underneath the patient's breast, basically. Okay, so we're just going to palpate. Just in a back and forth motion. Thank you. All right. I think you can see. I'm going to get right up in here too. Okay, so I didn't feel for any type of abnormalities there. Now what I'm going to do is I palpated, I percussed, and I'm going to do is auscultate the patient's lung field. And this will just be with the diaphragm side of my stethoscope. I just want you to breathe in and out, okay? And each time I move the stethoscope, just breathe in and out.
Okay.
Okay, so while auscultating the patient's anterior lung field, I didn't hear any wheezing, any crackling, any rhonchi at all. So within that lung field, everything was clear and heard equally in both the left and the right portion. Okay, now what I want to do is listen for your heart sounds. Okay. So what we'll do is that we'll start right here at the sternal notch, go down a little here, and over to the right will be the aortic, and then that's be the second intercostal. Sliding over again in the second intercostal space will be pulmonary. Right between in the middle would be Erb's point, and then you can lift your shirt up for me. Okay, right down here would be the fifth intercostal, and this will be tricuspid. And right down here would be mitral. Okay, now I'm just going to listen to your heart sounds. You can just breathe regularly for me. Okay, lift your shirt for me. Okay, so with that, I didn't hear any abnormalities with those heart sounds. S1 and S2 were heard. Didn't hear any abnormalities for S3 or S4. Also with the apical pulse, that was normal and regular as well. Didn't notice any type of heaves or lifts with that as well. Okay, so now what I'm going to do is examine your back. Okay, so again, earlier I did palpate the patient's back. Again, I didn't feel for any hardening at all, no masses, no bulges. Okay, I'm sorry, yep, that was a palpate. Now what I'm going to do is just map out the patient's lung field. Here we have C7, right in here, and make a chicken wing for me. Right underneath the patient's scapula, right in here is T7, and then going 3 down. So that'll be scapula's right there. So 1, 2, 3. Okay, that'll be T7. So the patient's lung field, let me bring this down some. Patient's lung field again is right here. Okay, now what I want you to do is breathe in and out. Okay, and that would be for symmetrical expansion. I didn't notice any abnormalities there. The patient did that perfectly. Now what I want to do is check your AP diameter. I'm just going to have you face straight. Okay. Okay, so for that, the AP diameter was perfect actually. It was a 1:2 ratio, which is a normal finding. Okay, now what I want to do is palpate your mapped out lung field, okay? And it's important not to palpate right on the scapula. Okay, so while palpating the patient's lung field, I didn't hear any abnormalities, or didn't feel for any abnormalities at all. Now I'm going to auscultate the patient's lung field, just checking for resonance. Didn't hear any in the anterior part of the patient's lung field. You can just breathe in and out each time I place my stethoscope on you. Okay, again, didn't hear any type of abnormalities. The lung field was clear and normal in both anterior and posterior, in both left and right regions as well. Didn't hear any resonance, which is great. Okay, now what I want to do is perform tactile firmness. I just want you to repeat 99 each time I place my hands in each region, okay? Okay.
99. 99.
Okay, I'm going to have you shirt up. Okay.
99. 99. 99. 99. 99. 99.
Okay, so with that, the patient performed that correctly. As I went down the patient's back, the sounds or the vibrations were diminished, which is a normal finding as well. Okay, and we did the, what is it? The 1-to-2 ratio and symmetrical expansion as well. We palpated and we percussed on anteriorly and posteriorly. Okay, so now what I want you to do is lay back for me. I'm just going to observe your abdomen.
Okay.
Okay, and just. All right, so just by looking at the patient's abdomen, again, skin temp is normal as well and dry, no excessive hair at all. The patient's abdomen is, her contour is flat. I'm not seeing any bulging, no signs of hernias, no distended veins, no pulsations either. Okay. The color is appropriate for ethnicity as well, again with pink undertones with her abdomen and throughout her body. Now what I want to do, I'm just going to map out each quadrant. Down here we are in the right lower quadrant. Up here is right upper quadrant, left upper quadrant, and left lower quadrant. Now I'm going to auscultate twice in each quadrant with the diaphragm side of my stethoscope. Again in the right lower quadrant. And we're just checking for bowel sounds. Okay, now we're in the left upper quadrant. I'm sorry, right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, so I didn't hear any abnormalities with that. All bowel sounds were heard in all four quadrants of the patient's abdomen. There were no, didn't hear any hypo or hyperactivity. Everything was normal. Now what I'm going to do is listen for bruits on the patient with the bell side of my stethoscope. And we're going to begin right below the xiphoid process. Listen to the abdominal aorta. The xiphoid process is there. I'm just going down a little bit. So here would be abdominal aorta. Okay, we're going to go to right renal, left renal. Okay, right iliac, just below and across from the umbilicus, and left iliac. Okay, so with that, no bruises were noted, which is a great finding. Also with the umbilicus, it is symmetrical and at midline. Okay, now what I'm going to do is palpate in all four quadrants and let me know if you're feeling discomfort. Okay. We're just checking for tympany. Okay, so tympany is noted. It was a little bit diminished in the right upper quadrant. Okay, now what I'm going to do is perform a light palpation and then a deep palpation.
Okay.
Again, let me know if you're feeling discomfort.
Okay.
Okay. Any apparent discomfort?
No.
Okay, now we're going to perform a deeper palpation. Apparent discomfort?
No.
Okay, so while feeling that, I didn't feel for any masses or bulges. I didn't feel for any signs of hernias at all. No severe hard spots at all. Everything felt normal as well, which is great. Okay, so I did that. Let me see. Okay, now I'm going to have you, you can put your shirt down for me. Okay, so now after we performed the abdomen, I'm actually going to have you stand up for me.
Okay.
Okay, I'm just going to observe your gait. So I just want you to walk back and forth for me. Now for this, we're just looking if the patient is uneven in any way with her walk. It appears that her gait was perfect. She didn't struggle with doing that either. Okay, I'm just going to actually go on this side so you can see me. Okay, so the patient's gait was appropriate. Let's see. Now what I want you to do is just go sideways for me and have your arms out. Okay, and your eyes closed. And I want you to touch your nose with your index finger. And again. Okay, any difficulties with that?
No.
Okay, so the patient did not have any difficulties performing that as well. Okay, I'm going to have you have your arms up again and back to your midline. Okay, that'll be adduction, abduction. Okay, now what I want you to do is have your arms out. Okay, and turn them out and back in. So that would be supination and pronation. Okay, now what I want you to do is grab my fingers. We're going to do a push-pull. Okay, any problems with that?
No.
Okay, the patient didn't struggle with that at all. Her upper body strength was great. I didn't feel any type of weakness at all when performing her upper body strength. Okay, so we did push-pull and arm raises. I want you to push against my hands and pull. Okay, no problems with that either?
No.
Okay, great. And we also did the finger grasp. Okay, now what I want you to do is I'm going to have you raise both your legs. Okay, there's one. Any problems with that?
No.
Okay, great. Now what I want you to do is a heel to shin slide for me.
Okay.
Okay, so what I want you to do is take your foot and slide it down your leg for me. Okay, and again. Okay, any problems with that?
No.
Okay, so the patient was able to form that correctly as well. Okay, now what I want you to do is lay back in bed for me. Okay, so I want you to push and pull. You can see.
Okay.
Okay, any problems with that?
No.
Okay, and we also did the leg raise. I checked for cap refill.
Mm-hmm.
Okay, now what I want to do is check your Babinski reflex to see if your toes curl inward or not.
Okay.
Okay. Same thing you can see. Okay. So the patient was able to perform that perfectly, which is a normal finding. Okay, so that would be negative. It would be negative if she couldn't be able to. It would be positive if she wouldn't be able to perform that. Okay. Let's see. So just to do a recap on everything. Let's see. Asked all of the subjective questions. We did the Glasgow Coma Scale. We did cap refill for fingers and for toes. I assessed the patient's hair and her skull. Again, didn't feel for any deformities at all. Her face, her ears, lips, and nose were all symmetrical and centered to her midline. For the patient's neck, we checked for bruise, carotid artery on both sides. We checked for lymph nodes as well. JVD, I'm not sure if I already said that, but it was checked. Or did I? Yes, I did check that. Actually, I'm going to have you do it again just to be sure. Just lay back for me and turn your neck on both sides, checking for findings. No findings there. Okay, so no findings for the patient's JVD. Okay, as far as the patient's lung field, I assessed that and mapped out the lung field, assessed the patient's heart as well with performing 8 to man. At the patient's back, I palpated on both sides. Before I forget, I'm going to check for crepitus. I also performed tactile fremitus, the 1:2 ratio, symmetrical expansions. I did that also. Auscultated anteriorly and both posteriorly. Let's see. We did some upper body strength, range of motion, and lower body strength, range of motion. We did the abdomen with her abdomen being flat. We did the percussions and palpating the abdomen and checking for bruise as well. And we did a lot of musculoskeletal movement as well, and everything came back normal and appropriate for the patient. There were no abnormal findings at all. Okay. We also performed all of the cranial nerves. And before I leave the patient's room, I'm going to, let's do some education first. Before that, let's going to perform check for crepitus. Okay. And it shouldn't feel like any type of popping or like crackling at all. We're checking for that. And no crepitus noted. Now, as far as education, not to perform a self, did you know how to perform a self-breast exam?
No.
Okay, now to be able to perform that, you could be lying down or in the shower with one of your arms raised, and you would, in a small circular motion, you would check for like any hard spots or like masses at all. You also need to make sure you check your nipples as well.
Okay.
Okay, and I can also give you a pamphlet on your way home to look that through just in case you forget.
Okay.
Okay, also since you're not a smoker, which is good, you're not a smoker, right?
No.
Okay, so since you're not a smoker, that's a good thing as well because that can cause lung cancer. You can have trouble breathing as well.
Okay.
Or also if you need to have surgery, it may be difficult for you to be intubated, so that's a good thing. Okay, now before I leave the patient's room, we're going to make sure her bed is lowered to the floor. She has on non-slip socks. She has her call light and table within reach. I'm also going to make sure I provide patient privacy and perform hand hygiene as well. Thank you.